Intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy (MTP) or induced abortion. Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts to one-fifth of the total number of conceived pregnancies in a year. One-fifth of total number of conceived pregnancies in a year. Whether to accept or legalize MTP or not is being debated upon in many countries due to emotional, ethical, religious and social issues involved in it. Government of India legalized MTP in 1971 with some strict conditions to avoid its misuse. Such restrictions are all the more important to check indiscriminate and illegal female feticides, which are reported to be high in India. Medical Termination of Pregnancy Amendment Act 2017 was enacted by the Government of India with the intention of reducing the incidence of illegal abortion and consequent maternal mortality and morbidity. According to this act, a pregnancy may be terminated on certain considered grounds within the first 12 weeks of pregnancy on the opinion of one registered medical practitioner. If the pregnancy has lasted more than 12 weeks but fewer than 24 weeks, two registered medical practitioners must be of the opinion, formed in good faith, that the required ground exists. The grounds for such termination of pregnancies are: the continuation of pregnancy would involve a risk to life of pregnant woman or of grave injury physical or mental health, or there is a substantial risk that if the child were born, it would suffer from such physical or mental abnormalities as to be seriously handicapped. MTP to get rid of unwanted pregnancies either due to casual unprotected intercourse or failure of contraceptive use during coitus or rapes. MTPs are also essential in certain cases where continuation of pregnancy could be harmful or even fatal either to the mother or the fetus or both. MTPs are considered relatively safe during the first trimester, that is up to 12 weeks of pregnancy. Second trimester abortions are much more riskier. One disturbing trend observed is that a majority of MTPs are performed illegally by unqualified quacks, which are not only unsafe but could be fatal too. Another dangerous trend is the misuse of amniocentesis to determine the sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by MTP. This is totally against what is legal. Such practices should be avoided because these are dangerous both for the young mother and the fetus. Effective counseling on the need to avoid unprotected coitus and the risk factors involved in illegal abortions, as well as providing more health care facilities, could reverse the mentioned unhealthy trend. Sexually transmitted infections, STIs, or venereal disease, VD, or reproductive tract infection, RTI. Infections or diseases which are transmitted through sexual intercourse are collectively called sexually transmitted infections, STI, or venereal disease or reproductive tract infections. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent years, HIV, leading to AIDS, are some of the common STIs. Among these, HIV infection is most dangerous and is discussed. Some of these infections, like hepatitis B and HIV, can also be transmitted by sharing of injection needles, surgical instruments, etc., with infected persons, transfusion of blood, or from an infected mother to the fetus too. Except for hepatitis B, genital herpes, and HIV infections, other diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pains, swellings, etc. in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or less significant symptoms in the early stages of infection and the social stigma attached to the STIs deter the infected person from going for timely detection and proper treatment. This could lead to complications later, which include pelvic inflammatory diseases (PID), abortion, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. STIs are a major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care programs. Though all persons are vulnerable to these infections, their incidences are reported to be very high among persons in the age group of 15 to 24 years, the age group to which you also belong. Okay. There is no reason to panic because prevention is possible. One could be free of these infections by the following simple principles. Avoid sex with unknown partners or multiple partners. Always try to use condoms during coitus. In case of doubt, one should go to a qualified doctor for early detection and complete treatment if diagnosed with infection. Infertility. A large number of couples all over the world, including India, are infertile. That is, they are unable to produce children in spite of unprotected sexual cohabitation. The reasons for this could be many: physical, congenital diseases, drugs, immunological, or even physiological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized health care units, infertility clinics, etc., could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, couples could be assisted to have children through certain special techniques commonly known as ART, assisted reproductive technologies. In vitro fertilization (IVF), fertilization outside the body in almost similar conditions as that in the body, followed by embryo transfer (ET), is one of such methods. In this method, popularly known as test tube baby program, ova from the wife or donor female and sperms from the husband or donor male are collected and are induced to form zygote under simulated conditions in the laboratory. The zygote or early embryos with up to 8 blastomeres could then be transferred into the fallopian tube (ZIFT, zygote intrafallopian transfer), and embryos with more than 8 blastomeres into the uterus (IUT, intrauterine transfer) to complete its further development. Embryos formed in vivo fertilization, fusion of gametes within the female, also could be used for such transfer to assist those females who cannot conceive. Transfer of an ovum collected from a donor into the fallopian tube (GIFT, gamete intrafallopian transfer) of another female who cannot produce one but can provide suitable environment for fertilization and further development is another method attempted. Intracytoplasmic sperm injection (ICSI) is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Infertility cases, either due to inability of male partner to inseminate the female or due to very low sperm counts in the ejaculates, could be corrected by artificial insemination (AI technique). In this technique, the semen collected either from husband or a healthy donor is artificially introduced either into the vagina or into the uterus (IUT, intrauterine insemination of the female). Though options are many, all these techniques require extremely high precision handling by specialized professionals and expensive instrumentation. Therefore, these facilities are presently available only in a very few centers in the country. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of all these procedures is to have children, in India we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption and it is yet one of the best methods for couples looking for parenthood. Summary: reproductive health refers to a total well-being in all aspects of reproduction. That is, physical, emotional, behavioral, and social. Our nation is the first nation in the world to initiate various action plans at national level towards attaining a reproductively healthy society. counseling and creating awareness among people about reproductive organs, adolescence, and associated changes, safe and hygienic sexual practices, sexually transmitted infectious STIs, including AIDS, etc., is the primary step towards reproductive health. Providing medical facilities and care to problems like menstrual irregularities, pregnancy related aspects, delivery, medical termination of pregnancy, STIs, birth control, infertility, postnatal child and maternal management is another important aspect of reproductive and child health care programs. An overall improvement in reproductive health has taken place in our country as indicated by reduced maternal and infant mortality rates, early detection and cure of STIs, assistance to infertile couples, etc. Improved health facilities and better living conditions promoted an explosive growth of population. Such a growth necessitated intense propagation of contraceptive methods. Various contraceptive options are available now, such as natural, traditional, barrier, IUDs, pills, injectables, implants, and surgical methods. Though contraceptives are not regular requirements for reproductive health, one is forced to use them to avoid pregnancy or delay or space pregnancy. Medical termination of pregnancy is legalized in our country. MTP is generally performed to get rid of unwanted pregnancy due to rapes, casual relationship, etc. As also in cases when the continuation of pregnancy could be harmful or even fatal to either the mother or the fetus or both. Infections or diseases transmitted through sexual intercourse are called sexually transmitted diseases (STIs). Pelvic inflammatory diseases (PIDs), stillbirth, infertility are some of the complications of them. Early detection facilitated both cure of these diseases. Avoiding sexual intercourse with unknown or multiple partners, use of condoms during coitus are some of the simple precautions to avoid contracting STIs. Inability to conceive or produce children even after 2 years of unprotected sexual cohabitation is called infertility. Various methods are now available to help such couples. In vitro fertilization, followed by transfer of embryo into the female genital tract, is one such method and is commonly known as test tube baby program.